Welcome everyone. Good afternoon. It's great to be with you. This is one of my favorite parts of my job is being able to talk to people about their benefits, how to use them, understand them, and how to better engage with them. So let's dig in. So our agenda today is going to take a look at the core medical plan benefits. We'll have a little review of the dental plans, and then there'll be time at the very end, after the very end of the session, for Q&A. So jot down questions that you have as we're going through information, put them in the chat. We will get to them at the very end. So here we go. So first off, preparing for your journey. Healthcare is a bit of a journey. And before you're going to depart on one or get going on one, you certainly need to prepare. So number one, you need to learn how your healthcare benefits work. How does all this work for you? You need to enroll in a plan that suits your needs. And to kind of evaluate that, just go ahead and start considering your healthcare needs for those of you and or your family for the coming year. You can compare options and costs and ultimately enroll by that deadline. So it's also an opportunity for you to review and update any information about you and or your dependents. So a lot to consider, and we want to make sure everybody really takes a good amount of time to really consider and put some thought into some of these things. So our first stop, core medical benefits. So we have the core plans that are available to us, and those are going to be either through Anthem or Cigna, depending upon which network you select. Within those plans, you have this entire list of additional benefits that are part of that health plan enrollment. So we've got Quantum Health, which is a new feature. We'll talk about that in detail. You've got behavioral health benefits. You've got your employee assistance program. There's pharmacy, vision, hearing, Hinge Health. All of these things we're going to talk about in a little more detail. But this is a very lengthy list of all of the items, all of the benefits and programs that are part of your enrollment. So a very rich plan design, the benefits that are there for you to utilize, and we certainly want you to better understand what's available to you and how to go about using them. So, types of medical plans. Let's dig into that first. So first off, the medical plans are PPO or Preferred Provider Organization plans. And the networks that are available to us to enroll in are either the Anthem Blue Cross Blue Shield, which is that Blues network that you'll hear some people refer to, or the Cigna network. So know that both the plans, whether either network, it's the same plans. The rates are the same by tier for either network. Both of these networks, neither include the need to have a referral to see different physicians or specialists. You have in-network and out-of-network benefits that are available to you, but using those in-network providers or facilities are going to have lower out-of-pocket cost for you. So this is real important. So there are, again, 4 plans to choose from. So whether it's Anthem or Cigna, you're going to have 4 plans to choose from. The plan and the plan designs are all the same for all 4 plans, whether it's Anthem or Cigna. So the differences in the plans are the cost share. It's the deductible, it's the maximum out of pocket, and the co-insurance. Those are the differences in the 4 plans. The benefits, the plan design, is exactly the same in all of those plans. So that's what you need to be considering when you're making your decision or your plan election for the coming year. What is the deductible? What is the maximum out of pocket? What is my co-insurance relative to what is the cost of the plan, and what are my healthcare needs for the coming year? So taking a deep dive into that as you consider is going to be really important. So no, you may have heard kind of, around the building, if you will, that there's an increase, a significant increase in the higher level plans, like the PPO 190 plans. And that's because those plans are no longer really financially sustainable. So those higher plans are very rich, meaning they provide more coverage than the cost justifies. So currently that PPO 100 plan that we've known pays out 30 cents more in claims for every dollar spent on premiums. So to be able to make that plan self-sufficient, it's got to be able to cover itself. The plan did undergo some premium increases that will better align with the cost and coverage, and to really kind of encourage us all to think and really evaluate very thoughtfully how we might be able to select a lower cost alternative. So we'll look at some of those significant distinctions between the plans in just a few minutes. So this change is in response to General Convention resolution and the need to increase premiums for those high value plans. So again, the PPO 100 have been increased by anywhere from 9 to 13% on average, compared to the lower plans, which got increases of around 3 to 4%. So this adjustment really creates a greater cost differential between the plans, which encourages all to evaluate and consider the more affordable options. And the goal really here is to make each plan self-sufficient, reducing that financial burden. So what to consider for your election for 2025? How much is the deductible? What is the maximum out of pocket cost, and what can I realistically afford to pay out of pocket? What does my healthcare cost look like over the last year, and what might I project it to look like over the coming year? I know we don't have a crystal ball, but we can kind of see historically what our healthcare costs have been and make some decisions based on that. So the premium, the monthly cost for each plan is really based on the lower deductible, the more expensive the more the monthly cost for each plan is based on a lower deductible, and the more expensive plan is going to have the lower deductible. The least expensive plans are going to have the lower deductible. Sorry, confused those. So higher deductible, less expensive, lower deductible, more expensive. So how much are you spending? How much do you anticipate? It's not an exact science, but the estimate is based on the history that that can help you better evaluate your options. So some key terms to know, make sure you're aware of. That copay is that fixed amount that you're going to pay for a covered service. And this is usually when you receive that service. So that could be like your basic doctor's appointment. For your primary care physician, it's going to have that flat copay amount. The deductible is going to be that full cost of healthcare that you're going to be paying until you reach that amount. And then you've got the out-of-pocket limit, and this is going to be the most that you will pay for covered healthcare expenses in the calendar year. And your coinsurance, which is involved in these plans, is going to be the percentage that you pay for the allowed amount of a covered service after meeting your deductible. So for example, in this Anthem PPO 100, Cigna PPO 100 plan, you see that deductible is 0. There's no deductible to meet. However, there is an out-of-pocket limit of $2,000 for an individual. And then you see on the out-of-network services, if you choose services or providers that are out-of-network, you are going to have a deductible to meet there, and the out-of-pocket limit doubles. So you see your co-insurance or for your, your co-pays for your office visits are $30 for primary care, $45 for specialist. This is the same for every plan. The co-pay is the same. So you've got your co-pays that vary for the different other services that are listed. And there's, again, those are going to be similar throughout all the plans. So the PPO 100, no deductible to meet, but this is going to be the most expensive plan. Then we drop down to the PPO 90. You can think about this. The plan's going to pay 90%. The coinsurance is 10%. So it's the 90-10 situation. The deductible is low at $500 for an individual, and the out-of-pocket limit, that max is $2,500. And then you see it doubles for those out-of-network services. As I said, the office visit copays are the same as we just saw on the 100, so no difference there. Similar copay for the urgent care and emergency care, but the other services have that coinsurance that you would be responsible for of 10%. So coinsurance is paid up until that maximum out-of-pocket limit is met, so it would be a 10% member responsibility there. Then we drop down to the PPO 80. Still a rich plan. You see the deductible jumped up by another $500, so still relatively low at $1,000. The maximum out-of-pocket jumped up a little bit. And again, those costs double if you're going to use out-of-network services. Office visits the same. This is the 80-20 situation where the plan's going to pay 80% of the cost of services and the member is going to pay 20% until that maximum out-of-pocket is met. Then we go down to the PPO 70 plan. Again, a great plan. The plan design is the same as those other ones, but a jump up in deductible again, a jump up in out-of-pocket limit, and the office visits are the same. It's the 70-30 situation here. The plan's going to pay 70%. You, the member, is going to pay 30% of that coinsurance for the various services that require coinsurance. Now I'm going to turn it over to Jeff for some quantum health information.
Thank you, Lori. Yeah, so quantum health, we've been hearing a lot about this. You may have read about it in Renee's email, very informative email about the open enrollment coming up, and also in some of the daily digests. So quantum health this is the biggest change that we're adding to the program this year in the way that we engage with our benefits, but lots of important information coming up here. So quantum health is what they call a healthcare navigator or a care coordinator organization. They're really one of the leaders in that field. Lots of group plans like ours are turning towards healthcare navigators to simplify, receiving care, because Lori talked about many different plans. We've got Cigna, we've got Anthem, and more information coming up on our pharmacy benefits and all that stuff. Well, quantum health will serve as a single point of contact for we members for to help us answer questions about claims or billing. You may be familiar currently with the Health Advocate Service. If you have used that, Quantum Health will go into effect starting January 1st for all of the types of services you may have been contacting Health Advocate for, and additional information as well. As we say, a single point of contact. Whether you're on the Anthem or Cigna network, Quantum will be your point of contact for any questions you have that you would previously or currently go to Anthem or Cigna for. Also for Express Scripts and the behavioral health benefits through the EAP. Their team is staffed with registered nurses, experts in the benefits field, and just a lot of really highly qualified individuals who are well versed in our plans. So one of the things that they'll be offering, we'll talk about in a moment here, will be assistance during annual enrollment. But they can help you find in-network providers. If you're looking for, let's say you move and you're looking for a new primary care physician, you wanted some assistance with that. Quantum is also a contact for that type of contact. So they can. It also says that we can still be able to contact our medical providers directly for services. So naturally, this is not going to replace the relationships you might have with a primary care physician. You're still going to be able to work directly with your providers, set your appointments, and review your after visit summaries and things like that. But they also are the conduit for those primary care physicians and other providers. So very important mention here that we replace ID cards. And Lori, if you could please, next slide. Okay, so we're now going to have one ID card. So I mentioned that we've got several carriers right now. If you have Anthem, you have an Anthem card and an Express Scripts card. A single ID card, and this is probably the most important thing to remember with this transition to quantum health, is that you will want to provide your quantum health card that will arrive in the mail during December to any physicians that you're currently seeing, because you will have a new plan number, and that will be on the ID card as well. So this is for any reason that you've been contacting your Anthem or Cigna network, or Express Scripts for pharmacy benefits. There will be a MyQ Health quantum card that you will carry for all those services. Next slide, please. Okay, so also in addition to the healthcare navigation information that we talked about, Quantum has these 3 different buckets of point solutions, which will also take effect in January 1. The Teladoc Health Services, if you're on Anthem and you've previously used their My Live Health Online, I believe it's called, with Anthem, and MD Live with Cigna, those telehealth services, the Teladoc Health Services becomes the new single source for that type of virtual visits during or beginning with January 1st. Magellan Healthcare is a very comprehensive behavioral health support program that is available through Quantum. Lots of information to be learned there as we dig into this in January. And then Personal Precision Oncology Management for cancer treatment. Really in-depth clinical support there for different types of cancers and different types of treatments. So it really enhances all of these point solutions, really enhance the benefits that we've had available to us and bring us new ways of taking out complexity and having additional support for the services we so need. Next slide, please. Okay, so annual enrollment support, I mentioned this a moment ago. For those of us in the plans with Anthem or Cigna, this applies to everyone. So during the annual enrollment period, you'll already be able to engage with Quantum's care coordinators. They'll be available by phone. I mention that because in the next, and we'll come up in a moment, but contacting Quantum and getting fully integrated, registering with them will follow. That comes with January 1st. But in the meantime, once October 21st hits, between October 21 and November 1, our annual enrollment period, we will be able to contact Quantum's care coordinators. They'll know who we are, that we're with the Church Pension Group, and there's a phone number that will be provided that you would call, and they will have the information on the plans that Lori just walked through. So if you're looking at plans that you're considering making a change to one of the other plans, the folks at Quantum are also your single point of contact during annual enrollment this year, and of course in the years that follow. So we mentioned the new cards, the new policy numbers, more information here on that. You will receive that new single card, and then just you have to provide that and make sure that replaces your medical and iMed and Express Script cards that you may currently have. Those old cards will not work after December 31st. Next slide. Okay, so one place to go, one team to help. Again, single point of contact. The Quantum number, they're available Monday through Friday, 8:30 a.m. to 10 p.m. Eastern time. And these are the digital ways that I mentioned. Now, if you're familiar with, currently with Anthem or Cigna or any of the other providers that we use, I know I'm big into downloading the apps and tracking my healthcare, situation through the Anthem Sydney app currently. Well, Quantum has the MyQCare app, and we'll be able to access that starting January 1. And also myquantumcare.org. If you want to register, we highly recommend, register yourself and get your dependents in there too, under myquantumcare.org beginning January 1, so that you can be fully integrated and engaged with Quantum and their services. And next slide. Okay, thank you. So behavioral health benefits, first in both the Anthem and Cigna networks, we have integrated, fully integrated, in-depth behavioral health services. And again, you would coordinate any care through Quantum. So this would be for office visits, med management, and inpatient and outpatient services. We talk about prior authorization may be required, especially for inpatient services for behavioral health. Generally, that will have a prior authorization need attached to that. And next slide, please. All right, Lori, you're up.
Thanks, Jeff. So as we continue to move down that long list of extra benefits that come with our plans, we're going to move into the pharmacy benefits next. So our prescription drug benefits are managed by Express Scripts, no different from where we have been in the previous year. So no changes there. The change is with Quantum, though, we're going to be contacting them regarding our information or concerns that we have with our prescription drug benefits. So Quantum is going to be your go-to beginning January 1st, as Jeff mentioned, for anything related to your prescription drug benefits. So just remember that the highlights of the benefit is that there are generic and brand name medication options that are available to you. We use Accredo with Express Scripts for those specialty pharmacy drugs. Those are discount programs that help us to save money on that. Express Scripts has a broad national retail pharmacy network, so those times when you have to get a retail prescription versus the home delivery, that's certainly available to you. Occasionally, there may be pre-authorization that is required. You will be notified about that, and if you need assistance, Quantum is going to be there to help you work through that. There is the generics that we're always trying to encourage because those have the greatest cost savings and are readily available. Home delivery for those maintenance medications. So nothing new there. That's kind of the same place we've been with Express Scripts over the past couple of years. But when you have concerns or you need assistance, you need some support in that prescription drug benefit area, you're going to call Quantum. So just to see how it's broken down, we see the copay situation here based on drug tier, with that generic being the least expensive, with the retail amount at $5 for your copay and up to $12 for home delivery. You've got your preferred brand name, which is the next tier going up, on to non-preferred. So it's the set copay costs for the retail versus the home delivery. And you see the dispensing limits of 30 days up, that goes up to 90. Just personal testimony. I love this. My prescriptions, mine and my husband's, arrive in our mailbox without fail. I get a text from Express Scripts telling me they're preparing it. I get another text saying it's shipped, get another text saying it's arrived, and there's never been an issue. So it is it's so efficient and so easy to manage your prescriptions on that 90-day home delivery dispensing option. So the next benefit that's also part of our benefit or our enrollment within one of those either the Anthem or Cigna plans is a vision, and that is through iMed. And so again, this is a preventive situation for vision care where you have a zero copay for your annual visit. So making sure you're getting those vision screenings every year at no cost to you. This is really important. It may be a benefit that you have not yet utilized, so encourage you to utilize it. If there is a need for frames or contact lenses, the benefit provides a $200 allowance every year, and they also provide different discounts on various products and services through iMed. So a host of really valuable benefits that are available through iMed. They do have a broad network. You can go to their website or download the app. I'm really big, as Jeff said, on downloading the apps and having it on your phone. You can find providers very easily based on your geographic location. So iMed Vision, don't pass up utilizing that vision benefit every year. And here's what the summary of benefits kind of broken down a little bit for you looks like. So there's no copay for you to pay. So there's no cost for that vision screening. You've got that allowance for frames. You've got a discount on other balances over that $200 amount. Different copay situations on the other services that are available. This is a very abbreviated list. There's a much longer list of the benefits that are also part of the iMed vision plan. So be sure to check those out. We have a flyer available for those so you can take a deeper dive to see what else is included in your vision care. And then we have our hearing benefit. So there is a hearing aid benefit through both the plans, Anthem or Cigna, and that is a maximum benefit of $3,000 every 3 years. So if you have hearing aid, if you have hearing issues and you need assistance with that, again, we encourage you to dig deep into that. Know that you've got this benefit that allows for $3,000 every 3 years for a hearing aid. Hinge Health. Is this you, Jeff? No, it's me.
No.
Sorry.
Okay.
Yeah.
Okay.
So Hinge Health, this is another really cool benefit. So Hinge Health was an expert medical second opinion service, and it's also a virtual at-home physical therapy service. So they are there to provide second opinions when needed on any kind of musculoskeletal issue that you may be having. So whether it's knee pain, ankle pain, hip pain, things that are going on with your skeletal system, they can provide a second opinion through their Hinge Health service. Through the too quick. Didn't mean to move that quickly. Also, if you are prescribed physical therapy, it is a great service where you can contact them and you can work with a personal physical therapy trainer at home. They will provide you the devices needed to be able to monitor your progress. They provide online coaching to work through the physical therapy program. And it's just a great way to make sure people complete their physical therapy prescription without, don't stop because you have to go to the facility to do it. You can now do it from home through this Hinge Health program. So this is a really cool benefit. I did subscribe to this for a physical therapy issue on my ankle, and it was just fabulous to be able to do it from home and not have to go to a physical therapy location. So really, really convenient. And again, no cost. There's no copay for this. There's no co-insurance. This is at zero cost for you as an enrollee in the Anthem or Cigna plan. Then we've got quantum healthcare management.
Me. Thank you, Lori. And thanks. That Hinge Health is so cool. That was amazing. Next slide, please. Yeah, so quantum healthcare management, sort of a review of a lot of what I spoke about earlier. Really at the core of what quantum is going to do for us, for members and our dependents. The services are really, helping coordinate care among doctors. So say you've got a treatment plan where you've got one physician that does a certain part of it, and then maybe have physical therapy, things like that. You don't have to, you coordinate all of that stuff yourself. You can contact Quantum either through my Q Care app or the website, or give them a phone call, and you'll be able to use all these care management. We mentioned this as well because currently, as I mentioned, with the teledoc and replacing the telehealth services that are currently with Anthem and Cigna, the care management program with Quantum, the January 1st will replace the Anthem care management program as well as Cigna. And each have their unique names. You can continue to use them through the end of the year, and then we'll transfer over to the type of services, just like everything else we've mentioned, through Quantum. So next slide, please, Lori. It also includes health utilization, or prior authorization. That's what we call it, which is also referred to as pre-certification. I mentioned it earlier, and now we'll go a little bit deeper into what prior authorization is. As the statement here says, the approval that's required prior to receiving certain services. So, if your primary care physician determines that there's another service that's needed through a different provider or facility, in order to deem that that's medically necessary, there would be a review process, to make sure that that is authorized for you by your plan, so that you're not shocked with some sticker shock of going to get something, just walk in the door and realize it may not be covered. So, to ensure that your plan is covering that, Quantum coordinates all the different steps involved with getting the prior authorization through for you. And next slide, please, Lori. Okay, so we mentioned telehealth a few times, telehealth and virtual visits, and how those visits have also been working with receiving COVID-19 services. We do have an update there. Next slide, please. Sorry. And telehealth and virtual visits. So we mentioned the telehealth. They'll be using the teledoc service in 2025 through Quantum. The member cost share is waived for those services again this year through the carriers, through those platforms, again through the entire plan year, so through December 31st next year. And mention that plan exclusions have been permanently removed to allow virtual visits with your personal health care providers. So that's when you have an appointment with your actual personal health care provider, rather than having a telehealth appointment with a provider that's assigned to you. So that's covered at the usual in-person office visit cost share. Traditionally, these types of visits are cost more dollars than the copay that you would pay on a regular office visit, but that has been matched with the programs that we offer for the COVID-19 treatment services. And next slide, please, Lori. All right, so one more additional benefit, United Healthcare Global Assistance Program. I love talking about this one. This is, first I like to mention, it's not traveler's insurance. So if you're taking a trip somewhere, do please, if you're interested in getting traveler's insurance, do please explore that through other avenues. But it's very helpful, assistance available to you 24 hours, 7 days a week. If you're traveling in anywhere that's 100 miles away from home, and say you lost a prescription that you brought with you, or you forgot your eyeglasses, or forgot prescriptions, lost some documents, things like that, give the United Healthcare Global Assistance a call, and they'll be able to assist with taking care of that. One thing too, they also have multilingual assistance. So if you're traveling, in another country where the local language is, one that the healthcare providers that you're visiting there speak, but you need someone that understands your benefits to speak with them. Give United Healthcare Global Assistance a call. They've got access to your records, to all of your healthcare records, and they could then speak and have an individual on their team converse with those providers in again areas where it's not the language you speak. So just lots of helpful services available through Global Assistance. And there's contact information here, but also on the next slide, please, Lori. All right, so another one where you're going to want to sign up if you haven't already, use this benefit, create an account, sign in, sign up. This is a service that will still operate independently from the Quantum Healthcare. Quantum Healthcare does amazing things is going to do amazing things for us on these shores. If you're traveling and you need additional services, that UHC Global provides, certainly recommend that you register with them and keep their contact information handy. And next slide, Lori. All right, that's you, Lori.
All right, so additional resources and really connecting with your benefits. I can't overemphasize enough how important it is to go ahead and establish those your accounts on these vendor portals that are available to us. Download the ID cards, download those apps on your smartphone. It just makes life so much easier. And I'd say to every group I ever speak to, do not wait until you're in a medical emergency or crisis and trying to figure out who I call, what to do, where's my ID card, and what benefits do I have. Don't wait for that to happen. Know before you go. So encouraging you to connect with Quantum Health. Obviously, this is a much streamlined approach than what we've been used to, where we would have to call Anthem separately, Express Scripts separately, etc. All of those things are happening right there with Quantum Care. So myquantumcare.org is going to be the portal. As soon as the app and as soon as the ID cards are ready, please make sure you download that app on your phone. You will be able to download a mobile ID card, save it to your phone, and just be ready and know before you go. So all of those resources are going to be able to help you find providers, review your options, get answers, verify coverages, etc. So a real important one, and make this the number one on your list during that annual enrollment process before we get to January 1st. So Express Scripts, again, you're going to use Quantum to connect with them. So getting that ID card loaded and knowing who to contact when you have any kind of questions or need assistance with your prescription drug benefits. The Cigna Employee Assistance Program. So another big program, another major benefit that is included in your enrollment and whether you're in a Cigna or Anthem medical plan. And so that program is for you as an individual. You are allowed to have 10 face-to-face sessions per issue or circumstance you may be dealing with. There are unlimited telephone consultations that you can have with a therapist or a physician or clinician. This benefit is what we call a household benefit. So anyone in your home that lives with you is entitled to use this benefit. So this could be your adult children that might be living with you. It could be your parents or your aunt or uncle. It's anyone who's living in your home that is eligible to use this benefit. So you'll see you're going to call Quantum to get access or help get assistance finding a provider, a clinician, whatever. You're going to use that toll-free number. And then for EAP members only, if you're only enrolled in an EAP program, you're going to continue to access that benefit via mycigna.com. So again, some additional features here. No cost. There's no co-insurance, no co-pays with this particular benefit. So it's no cost to you, and they are available 24/7. Accessing the Cigna EAP resources online. Again, it's that portal. If you haven't already done so, I highly recommend you go ahead and do so. You can get access to a list of providers and other information about the EA program that's readily available to you through the online access. So dental benefits. What's happening in dental? No changes from last year. We've got the same three dental plans with Delta Dental. Those plans provide 3 routine cleanings every year. There's zero cost for that diagnostic or preventive care, a huge nationwide network. So again, you're going to see the plans broken down, and what you'll see what the annual benefit limits are by plan, etc. But going to cpg.org/Delta Dental, you can get a full rundown of what all of the benefits are that are included in these dental plans. So no change from the current year that we're in. We are continuing with Delta Dental in those same 3 plans. So that first one is the highest plan, or the top of the top level plan. And you'll see here within that PPO network, in this premium plan, there is a benefit limit of $3,000. So again, personal testimony here. I had 2 crowns this year. I paid out of pocket approximately $140 for each one, and the plan paid the rest. So it was major helpful for me this year. So, but I made sure I stayed within that PPO network so that I am receiving or able to access that annual benefit limit. So in the middle network, called the Premier Network under this plan, it's a $2,500 annual benefit. So still a very rich benefit, but $500 less an annual benefit than the PPO network. And then out of network, still a great plan. So if you're using a dentist that is not in a Delta Dental network, you have a $2,000 annual benefit limit here. So like I mentioned, no cost for any of those preventive or diagnostic services. Basic and major restorative services being covered at 85%. So those 2 crowns I had were covered at 85%. I paid my $15. Orthodontist services, there's a maximum limit of $2,000 in the PPO and Premier networks, and slightly lower in the out-of-network dental network of $1,500. So this is the top plan, if you will, or the most expensive plan, very rich plan. The next one going down is the comprehensive plan. Still a very rich and great plan, but you see the annual benefit limits are slightly lower than that premium plan. But again, the highest in the PPO dental network. So using one of the Delta dentists in the PPO network is really important to get the most benefit. And then the Premier network drops down $500, and then the out of network drops down another $500. So you can kind of see, compare and contrast what each one of those networks look like underneath each one of these plans. Again, no charge for preventive and diagnostic services. The basic restorative remains at 85% that the plan pays. Major restorative drops down to 50%, and slightly lower orthodontia lifetime maximum amounts. And then the basic plan. So this is kind of the opening level dental plan. So the annual benefit limit under the PPO network, the highest network of dentists, is going to be $2,000, drops down another $500 in the Premier network, and then down to $1,000 out of network. Basic restorative drops to 80% coinsurance, so just slightly lower than what we just saw in the comprehensive. Major restorative, more than half is at that 40% coinsurance. So you'll pay a little bit more for the major restorative services in this plan versus the other 2. There are no orthodontist services provided in this particular plan. So you've got the 3: basic, comprehensive, and premium. And then Delta Dental also offers this Smile Way wellness benefit. And this is available to people who are diagnosed with certain conditions. Some of these conditions require additional dental care. Just dental health coverage is really needed for some of these things. So if you're diagnosed with any of these, you can reach out to Delta Dental directly and receive additional benefits or coverages, an expanded coverage amount for some of these conditions. So this is just good to know should you be in any of these situations. So the Smile Way wellness benefits, with their expanded coverage, you'll see that they provide 100% coverage on the periodontal scaling and root planning procedure per quadrant or per calendar contract year. So they've got these additional coverages on some of the other more intense or expanded benefits that might be needed based on some of those conditions that were previously shown. So you can easily opt in through the Delta Dental website /SmileWay, or by calling Delta Dental, as I mentioned, and they are available Monday through Friday. So with that, just disclaimer, all of our plan documents override anything that you heard here. And now I'm going to send it over to Human Resources. And let me stop sharing so you can pull up your deck, Joe.
Thank you, Lori.
Thank you.
Okay, so as I said, joining me today from Human Resources is Jocelyn Donat and Joe Seletsky. We'll move on. So the agenda is the flexible spending accounts. We have the healthcare FSA, the dependent care, and transportation. We'll move on to long-term disability, pre and post-tax elections, time and action plans, and then we'll start with questions and answers.
Okay, flexible spending accounts. So everyone at CPG can participate with a flexible spending account. The IRS limitation, maximum contribution amounts for healthcare is $3,200, and for dependent care is $5,000. Employees that have leftover credits, they can also have 25% of their unused credits help enroll the employee into a healthcare FSA. If you are making employee contributions from your paycheck and you have leftover credits, the amount of the maximum is $3,200 in combination of both contribution sources. Anyone that is enrolled in a FSA account will receive a debit card from Health Equity, who is our vendor, and you will be able to use the card for your healthcare purchases. Just a note, if the maximum contribution amounts change and we're notified the IRS is increasing them, we will let everybody know so that during annual enrollment, when the portal is open, anyone that wants to contribute the maximum amount will have the ability to go back and make the adjustment to their contributions. For employees that are enrolled in the FSA, if you have unused balances, you will have the first quarter of the calendar year, you will be able to submit claims for the previous calendar year or planned year's contributions. Once that the carryover period is over, which is March 31st, employees that have unused balances will have the money carried into for use on June 1st, 6 to 8 weeks from March 31st. If you have excess of $640, the amount will be forfeited. The maximum IRS carryover amount is $640 for the next plan year. Anyone interested in enrolling into FSA during annual enrollment, which is October 21st through November 1st, will have access to Health Equity's portal. You will log on to the portal and you will enroll, and you will indicate how much money you want to contribute on a biweekly basis for the next plan year. And Renee, long-term disability.
Okay, long-term disability, pre and post-tax elections. So as you know, long-term disability is a benefit that will kick in once you have been disabled for more than 26 weeks. Our carrier is Unum. They are our carrier for short-term disability, long-term disability, and leave administration. With regard to pre and post-tax elections, if you elect pre-tax, this means that should you become disabled for more than 26 weeks and possibly permanently disabled, your benefits will be taxable. So your benefits are 60% of your salary, but if they're taxable, it will be less than 60%. If you elect post-tax, employees who elect post-tax are paying tax on the imputed income of the value of the premium that CPG is paying on your behalf. Now, you may ask, well, how do I know what that imputed income is? If you go to your total reward statement, the amount on an annual basis is listed on your total reward statement under LTD. You can also see the biweekly amount on the ADP portal when you go in to complete annual enrollment, when you go to the LTD option and you hover over employer cost, the biweekly amount that you would pay tax on as imputed income is featured there. So in order to maximize your disability benefits and put more money in your pocket if you are disabled on a long-term or permanent basis, post-tax will do that for you. If you have any questions, please feel free to contact me regarding the difference. I know it's confusing, and I often have employees say that they are unable to decide. So please contact me for any questions. Time and action plan. Now, as you know, we have communicated that this is an active enrollment for your medical plan. Your current year's plan, 2024, or if you've waived the medical plan, the waiver will not carry over to the 2025 plan year. So open enrollment starts on October 21st. I will send out an email announcing its opening and provide you with additional information, including the booklet for the ADP instructions. On November 1st, annual enrollment ends. Any forms, including the waiver, if you waive insurance to opt out of medical, are required to be returned to Human Resources by November 27th. From December 1st to December 31st, the ID cards for Quantum will mail to you. If you want to avoid any concerns about not having your ID card, I strongly recommend that by December 15th, you download the app. We know that it's holiday mailing, and while the cards will be mailed on time, there may be a delay in delivery as a result of the holiday season. You can totally avoid that if you download the app, because your ID card will be available on the app. On January 1st, 2025, all new coverage programs that you elected during annual enrollment become effective.
So just quickly, Renee has indicated that this year is an active enrollment for medical only. So what that means is everyone has to do something to indicate how, what medical benefits they will elect for next year. So you will make that election in ADP Workforce Now. If you are, you will not, as I said, be automatically mapped to your prior year's election. So now 2 more things so that we can answer some questions. If you are currently enrolled in a medical plan and you don't make an election during this active enrollment, or if you don't waive your coverage, you're going to be enrolled into the PPO 80 plan of your current network. So if you're currently in Anthem 100 and you don't respond during this active enrollment process that you're going, if you don't respond, you will be auto-enrolled into the same. If you're in Anthem, you'll be enrolled in the Anthem PPO 80. If you're in Cigna, the Cigna PPO 80. So at your same tier. So if you're enrolled as a family, you'll be enrolled as a family. But the point that we're making is we want you to be actively enrolling and making your choice. Again, the last point is if you don't currently participate in one of our medical plans and you do not make an election during this active process and you don't complete an opt-out form, so if you don't currently have any coverage, you will automatically be enrolled. We had to select one in employee-only coverage into the Anthem PPO 80 medical plan. So what we're saying in these last 2 bullets is if you forget to enroll, despite the multiple reminders you will be getting, and you don't make an election, that we will automatically be enrolling you in a PPO 80 of sorts. So just please, the point we're trying to make is make your own elections and don't forget to do so. So we want to just address some of the questions that have popped up and I think we can go through these quickly, Renee,
Yes.
in the session, and then we'll take some in the room. But we're going to start with the ones that are in the chat.
And I'll read off the questions.
Okay.
To manage my prescription refills, do I contact Express Scripts or Quantum?
Yeah, so you can reach out to Quantum. You'll still have you can still reach out to Express Scripts, and if you still have the Express Scripts app on your phone, you can manage your prescriptions. You can continue to do that. If you need assistance, if you are experiencing a gap in getting information or not getting the help that you need from Express Scripts, then please reach out to Quantum for assistance.
Okay. Is the presentation somewhere we can access? Yes, we are recording this. And it will be posted to the intranet. If we choose to use our provider's telehealth so we can see our regular doctors, is it treated as an out-of-network visit?
Yes, so those networks are no longer going to be supported. So Quantum is providing that one teledoc platform for Anthem and Cigna members to use.
Okay. May you describe how the dependent care FSA works? Is it managed through health equity? Will the full amount be available at the beginning of the year like the health care FSA? Joe, I can take this. So the dependent care, we take a deduction based on your election. You aren't eligible for reimbursement until you submit the bill that you've paid for the dependent care. Dependent care is managed through health equity. And as I said, it is not like the healthcare FSA. The money is not fronted. So you will only be reimbursed for the amount that has come out of your paycheck at the point that you submit a bill. And if you don't utilize the money, it will be forfeited at the end of the year. With regard to, will our explanation of benefits EOB be available on Quantum Health, or do I still need to go to the Anthem website? Lori,
Yeah.
I can answer that. So the explanation of benefits for services through December 31st, 2024 will be on your Anthem or your Cigna network. You will still use that access on those websites to get to your explanation of benefits for any services. There is a bit of an overlap. We had a webinar on last Friday, which will be available and posted to the intranet. And John Surveys explains that there is a bit of an overlap for the end of the year where Quantum will have access to those explanation of benefits, but you will still have access to them through the Anthem or the Cigna portal. Next question. You can see up, okay, exactly what I had said, but Lori had explained that you will see them for approximately 2 years after the 1/1 effective date of Quantum. Will we get a separate card for IMED or single card we received in December 2024 cover that as well?
Yeah, so the ID card will be will have the Anthem and Cigna logo on it. For IMED, you will want to use your existing IMED ID card. So that stays in effect. Just hang on to that card, download it from the app or whatever. So Quantum won't necessarily have IMED ID information for you, but you can still use your IMED ID card that you currently have. So.
Okay, when we hand providers our Quantum card, how do we address any questions they may have about the different card? Do we just direct them to call Quantum?
Yeah,
And-
so the information about what providers will be doing or need to do, like they typically do, like when you hand them your Anthem or Cigna card, on the back it has the information on where they're going to submit claims. Same thing for Quantum. So the idea here is to make sure that your providers and your pharmacy has your new ID card because it's a new member ID and a new group ID. So your current providers are not going to have that information. So if they try to submit a claim under those old ID numbers, it's not going to work. And so it's going to look like you don't have coverage. So those coverage confirmations are going to go through that information that is going to be provided on the back of the Quantum ID card.
Okay. I will be on vacation and don't want to miss enrollment. Can I provide you with my form with my signature? If you are not going to be available to complete the annual enrollment during the whole time span of October 21st to November 1st, then we will accept a completed form. However, you should know that you will be able to complete annual enrollment if you have the ADP app. So it's very easy to do it online, whether you're on the computer or whether you do it on your phone and you're on the ADP app. Does anyone have any other questions that haven't been submitted in the chat? While we're waiting to make sure that we've responded to the questions, I just want to take the opportunity to remind you that we have Wellness Fridays in October. On last Friday, we had the webinar on quantum health. It was recorded and will be posted to the intranet. There are some questions that have already arisen, but there were other things that came up during the webinar. So I encourage you to access that recording. I also want to remind you that on October 11th, the webinar is going to be all about leaves. Joe Seletsky and I will be hosting that one. On October 18th, the EAP will be joining us. And on October 25th, Fidelity will be conducting the webinar and giving us an update on Social Security benefits. As a follow-up, this is the first of 4 sessions, 4 information sessions. There are 2 more sessions on October 16th at 10 a.m. and 2 p.m. There is another session on October 21st at 10 a.m. Annual enrollment will open on October 21st and will close on November 1st. With regard to the FSAs, enrollment in the FSAs is not through ADP. It is through the portal with Health Equity. If you are currently enrolled in the FSAs and you have the access to their website, you will get a reminder that it's time to enroll. If you never participated in the FSA before, you would register to get access to be able to enroll. And keeping in mind that for those of you that were with the PPO 100 and maybe looking at the PPO 80 or 90, now that you have a deductible, if you haven't participated in the FSA, I strongly encourage you to consider putting some money aside pre-tax. That will be one way that you can help with regard to meeting those expenses, because once you enroll in the FSA, the health FSA, whatever your election is for the year, that money is available on January 1, the full amount. Do we have any other questions?
Renee, I'm not sure. Did we get the question about gym membership? I think that's something that's for the new.
See. Hold on, let me see. Let me scroll down. I'm not seeing it.
Is there any gym memberships to elect for anyone?
So there are discounted gym memberships. Joe can provide you with that information. If you send him an email, he will provide you with the information. We will also be posting that information on the intranet You can find it now from the 2024 information that was provided on the intranet, and it's under the vendor section. But we will be updating that information. The only change for the gym membership is that the cost is going to be going up, and notification of that will be communicated to the employees that are currently participating in a gym membership.
I'm going to just say one more word about the active enrollment. Why it's an active enrollment goes back to Lori's intro, where she talked about the medical plans first and the rising costs of the two highest, the two most expensive plans, the PPO 100 and the PPO 90. Because the costs have gone up, we're still also increasing our credits, but we just want for employees to really take a moment to look at those costs because they differ, in our opinion, more than they have historically year over year versus last year. I think she mentioned the two highest are between 9 and 13%. And the others are about 3% to 4%. And so big difference in your biweekly deduction. And so we are just ensuring that you take that moment to acknowledge whether you're comfortable accepting that if you're currently in the PPO 100 or PPO 90. And if you are and you feel that you want to continue to get that plan, you can then elect it, but at least you're taking that moment to see the difference between what you may currently pay versus what you are going to pay versus waiting for your first pay period to see the deduction has gone up significantly. So that's the reason behind the active enrollment this year on medical, is just to make sure every employee knows there's a change year over year and that you're making an educated decision and versus just doing the roll me on forward method. So just if you have questions, we want to make sure that employees just are alerted appropriately and educated properly.
Well, we thank you for joining us for this information session. It will be available on the intranet. We did record it, so if you want to revisit any of the information, you will be able to access it. And thank you very much for joining us.